Rich doctor sees homeless man studying medicine in old books and changes his life forever. Dr. Richard Matthews was having another busy day at Mercy General Hospital in Chicago when something completely unexpected caught his attention. There, sitting on a cardboard box in the hospital's side corridor, was a middle-aged man who appeared to be living on the streets, but who was completely focused on reading a thick book. What intrigued Richard the most wasn't just seeing someone reading, but realizing the book was an advanced cardiology manual. The man wore a grey beanie pulled down to his eyebrows, had a well-groomed salt-and-pepper beard despite his worn-out clothes, and around him was a small pile of other medical books that looked like they had been read many times. "Excuse me, sir, but you can't be here," said Emily, the receptionist, approaching with a firm but polite tone. "This is a restricted area of the hospital." The man looked up from his book for the first time. Richard could see they were intelligent eyes, which contrasted with his disheveled appearance. "Just a few more minutes, please," the man asked in a calm, polite voice. "I'm almost finished with this chapter on ventricular arrhythmias." Emily was confused by the technical vocabulary but held her ground. "Sir, I need to ask you to leave. These are the hospital rules." It was at that moment that something extraordinary happened. Emily was carrying a folder with medical records, and one of the sheets fell to the floor right near the man. He bent down to pick it up, and involuntarily, his eyes scanned the document. "Excuse me," he said, still holding the paper, "but there's a mistake in this prescription. The digoxin dosage is too high for a patient of that age and weight. It could cause poisoning." Emily took the paper back, annoyed. "You shouldn't be reading that. It's confidential information." "I didn't mean to read it," the man explained. "But when I saw the number 0.5 milligrams, I couldn't help but notice. For an elderly patient, 78 years old and weighing 65 kilograms, the dose should be no more than 0.25 milligrams. Dr. Richard, who had been observing everything from a distance, approached, intrigued. He quickly checked the record Emily was holding and confirmed there was indeed a dosage error. "How do you know that?" asked Richard, genuinely curious. The man looked at him for a moment, as if weighing whether he should answer. "I've been reading about medicine for a long time," he said simply, turning his attention back to the book. "Emily, I'll handle this," Richard said to the receptionist, who walked away, relieved not to have to deal with the situation anymore. Richard crouched down next to the cardboard box. "My name is Richard Matthews. I'm a cardiologist here at the hospital, and you are?" "John," the man replied without looking up from the book. "John Miller." "John, may I ask where you learned about medicine?" John closed the book slowly and looked directly at Richard. "Doctor, I know my appearance isn't very trustworthy, but I can assure you I know this subject. I've been studying for years." "It's not about your appearance," said Richard. "It's just that I rarely see anyone, even among my doctor colleagues, identify an error like that so quickly. Do you have any formal training in the field?" John hesitated, as if a shadow had passed over his face. "I did, doctor, a long time ago." "What happened?" "I'd rather not talk about it," said John, opening the book again. "If you'll excuse me, I'd like to continue reading." Richard stayed there for a few more seconds, watching as John read with impressive concentration, making notes in the margins with a small, worn-down pencil. "John, can I ask you a technical question?" John looked at him again. "In a patient with severe aortic stenosis, what would be your approach to evaluating the need for surgery?" John didn't hesitate. "First, I would assess the symptoms: dyspnea, angina, or syncope. Then an echocardiogram to measure the pressure gradient and valve area. If the area is less than 1 square centimeter, or the mean gradient is above 40 mm with symptoms, surgery would be indicated. I would also consider the patient's age and other clinical conditions." Richard was impressed. The answer was completely correct and demonstrated deep knowledge. "John, do you have a place to stay at night?" "Yes, I do, doctor. Don't worry about me." "And these books, where did you get them?" "Some I buy at used bookstores when I can save up some money. Others, people who know about my interest give them to me when they get too old." Richard noticed that the books were indeed well used, with yellowed pages and some loose leaves, but they were all of good quality and still current. "John, can I talk to you again tomorrow?" "If I'm here, doctor. But I can't promise anything." Richard stood up, still processing the strange encounter. For the rest of the day, he couldn't stop thinking about John. There was something in his eyes, an intelligence that seemed familiar, but also a deep sadness that he couldn't decipher. The next day, Richard arrived early at the hospital, hoping to find John in the same spot. But the cardboard box was empty. He asked the security guard if he had seen the man. "Oh, the guy who's always reading. He left very early today, around 5 in the morning. He always leaves early and comes back in the late afternoon." Richard became curious about John's routine. During his lunch hour, he decided to take a walk around the hospital surroundings to see if he could find him. 3 blocks away, in a small square, there he was, sitting on a bench with the same books, but this time reading about neurology. "John," called Richard, approaching. John looked up, seeming a bit surprised. "Dr. Richard, what are you doing here?" "I was worried when I didn't see you at the hospital this morning. I left early. Sometimes I need to take care of a few things." Richard sat on the bench beside him. "Can I ask about these things you need to take care of?" John closed the book again. "Doctor, you seem like a good person, but I prefer to keep my privacy. I hope you understand." "John, I know we just met, but there's something about the way you talk about medicine that intrigues me very much. You're not just someone who reads as a hobby. There's a deep knowledge there." John was silent for a long moment, looking at the trees in the square. "Doctor, we all have a story. Some are more painful than others. Mine. I prefer to leave in the past." "I understand. But John, can I make a proposal?" "What kind of proposal?" "The hospital always needs help with simple jobs. Nothing medical, of course, but things like organizing documents, helping in the medical library. It doesn't pay much, but it's honest work." John looked at him with an expression that Richard couldn't interpret. "Doctor, I appreciate the offer, but I can't accept." "Why?" "I have my reasons." "John, can I be direct with you?" "Of course. I think you used to be a doctor, and I think something happened that made you stop practicing." John's face closed off completely. "Dr. Richard, you are mistaken. I was never a doctor." "John—" "Doctor, with all due respect, but I'd prefer you not continue this conversation. If you'll excuse me, I need to go." John quickly gathered his books and stood up. "John, wait." But he was already walking quickly away from the square. Richard stood there alone with more questions than answers. Dear listener, if you're enjoying the story, please take a moment to like and especially subscribe to the channel. It really helps us who are just starting out, now continuing. In the following days, Richard looked for John in various places around the hospital but couldn't find him. He began to wonder if he had been insensitive for pressing the man with personal questions. Maybe John had decided to distance himself because of that. A week later, on a particularly busy morning, Richard was entering the hospital when he heard an argument at the entrance. "Sir, I've already told you can't enter without authorization," said Gary, the security guard. "I just need to return this," replied a familiar voice. Richard turned and saw John holding a book in his hands. "John," he called, approaching quickly. "Gary, it's all right. I know him." "Doctor, he was trying to enter with this book. Said someone forgot it on the park bench." Richard looked at the book. It was a pharmacology manual that he recognized as being from the hospital library. "Thank you for returning it, John. Where was it?" "On the bench where we talked last week. Someone must have forgotten it." "John, can I talk to you for a moment?" John hesitated, but nodded yes. They moved away from the entrance. "I missed you these past few days." "Doctor, John, I want to apologize if I was invasive in our other conversation. It wasn't my intention to make you uncomfortable. You didn't do anything wrong, Doctor. It's complicated." "I understand, but I wanted you to know that my job offer still stands. No questions, no pressure. Just an honest job if you need it." John looked him in the eyes for a moment. "Dr. Richard, can I trust you?" "Of course." "If I accept this job, do you promise not to ask questions about my past?" "I promise." "And if I say I need to work only in places where I don't have direct contact with patients?" "I promise to respect that too." John took a deep breath. "Then I accept the offer." Richard smiled. "Great. I can take you to meet Mrs. Margaret, who manages the medical library. She always needs help organizing and cataloging books and documents. As they walked through the halls, Richard noticed how John observed everything around him with a familiarity that seemed involuntary. It was as if he knew every corner, every room. "John, can I ask if you've been in this hospital before?" John stopped walking for a moment. "Doctor, you promised not to ask questions." "You're right. Sorry." They arrived at the medical library, a quiet and organized space where Mrs. Margaret, a woman of about 60, was carefully organizing a stack of medical journals. "Mrs. Margaret, this is John Miller. He's going to help you with the library organization." Margaret looked at John with a bit of surprise, but soon smiled kindly. "That's wonderful, John. There's a lot of backlogged work here. Do you have any experience with libraries?" "I have a little, Mrs. Margaret. I like books very much." "Perfect. You can start by helping me sort these journals by specialty and year of publication." Richard watched John take the journals and begin organizing them with impressive efficiency. He not only knew all the medical specialties, but also organized them by order of importance and relevance. "Mrs. Margaret, John will only work a few shifts per week. If there are any problems, you can come to me." "Of course, Dr. Richard. John seems very competent." Richard said goodbye and went to tend to his patients, but throughout the day he passed by the library a few times. Each time he looked in, he became more impressed. John not only organized the materials, but also read the latest articles with a speed and comprehension that demonstrated deep knowledge. At the end of the first workday, Richard met John at the exit. "How was the first day?" "Very good, Doctor. Mrs. Margaret is a special person." "John, can I make an observation?" "Sure." "You organize the medical materials like someone who deeply understands the subject. It's not just alphabetical or by date." John walked in silence for a few seconds. "Dr. Richard, I read a lot. Have for years. It's natural that you understand a bit about these matters." "A bit?" "John, today I saw you organize articles on cardiac surgery more efficiently than many residents who work with me. You promised not to ask questions. I'm not asking, I'm just observing." They reached the hospital exit. "John, where are you going now?" "Home, Doctor." "Which is where, exactly?" John hesitated. "It's temporary, Doctor, but it's safe." Richard understood that John didn't want to give details, but a genuine concern came over him. "John, if you need anything at all, you can come to me, all right?" "Thank you, Doctor. See you tomorrow." Richard stood watching John walk away down the busy street of Chicago. There was something about that man that deeply intrigued him, a combination of brilliant intelligence and profound sadness that he had never seen before. In the following weeks, John became a constant presence in the hospital library. Mrs. Margaret was delighted with his efficiency and knowledge. More than that, she began asking John for advice on which materials were most important for keeping the library updated. "Dr. Richard," Margaret said one day, "that John is a treasure. He knows more about medicine than many doctors I know." "How so, Mrs. Margaret?" "Just today, a resident was looking for information on a rare case of cardiomyopathy. John not only found the most relevant articles in minutes, but also suggested some publications the resident didn't even know existed." Richard became thoughtful. "And what did the resident think?" "He was impressed. He asked if John was a retired professor from some university." "And what did John say?" "He said he just likes to read. But Doctor, I've worked here for 15 years. I've seen plenty of people who just like to read. John is different. He has practical knowledge, not just theoretical." That afternoon, Richard decided to spend more time in the library. He found John organizing a section of neurology books. "John, can I help?" "Of course, Doctor." They worked in silence for a few minutes, until Richard decided to test him. "John, have you read anything about the new protocols for stroke treatment?" John stopped what he was doing. "Yes, I have. They're interesting, especially the time window for thrombolysis. They increased it to 4.5 hours in specific cases. And what do you think of the new mechanical thrombectomy techniques?" "They're promising, but they require a lot of experience from the surgeon. Patient selection is crucial. Not everyone benefits." Richard fell quiet. John was not only up to date with the latest developments, but he spoke with the authority of someone who had practical experience. "John, Doctor, I know what you're thinking, but please, respect our conversation." "All right. But can I say one thing?" "Of course." "Whatever your story is, John, you are a special person, and I'm happy you're here with us." John looked at him with an expression mixing gratitude and sadness. "Thank you, Dr. Richard. That means a lot to me." 2 weeks later, something happened that would change everything. Richard was leaving a complex surgery when he heard shouts coming from the hallway near the library. "Someone call a doctor, quick!" He ran towards the shouts and found a chaotic scene. An elderly man was lying on the floor, apparently having a seizure. Several people were around, not knowing what to do. "Everyone step back, please," said Richard, kneeling beside the man. But before he could fully assess the situation, John appeared out of nowhere. "Doctor, it's an epileptic seizure," said John, quickly kneeling on the other side of the patient. "But look at the color of his lips. They're cyanotic." Richard looked and confirmed John was right. "There's something obstructing the airway," John continued. "We need to position him on his side and check his mouth." Together they positioned the man on his side. John, with sure and precise movements, opened the patient's mouth and removed a dental prosthesis that was obstructing his breathing. Immediately the man stopped convulsing and began to breathe normally. "How did you know?" asked Richard, impressed. "The seizures were secondary to a lack of oxygen," explained John. "The cyanosis was what alerted me. If it were primary epilepsy, he wouldn't have that coloration." Richard kept looking at John. The movements he had made weren't those of someone who had only read about medicine. They were those of someone with years of practical experience. The man began to regain consciousness. A few minutes later, he was completely lucid and thanking them. "You saved my life," he said. "I'm Robert Johnson, the owner of the bakery on the corner. If it weren't for you two—" "I'm glad you're okay, Mr. Johnson," said Richard, "but the one who really identified the problem was John here." "John, thank you so much. If you need anything at all, just stop by the bakery." After Mr. Johnson was taken for some routine tests, Richard turned to John. "John, we need to talk." "Doctor, I know what you're going to say." "You do?" "That my reaction wasn't normal, that I demonstrated too much knowledge." "Exactly. John, I'm not an idiot. What you did there wasn't luck or intuition. It was solid medical knowledge and practical experience." John leaned against the corridor wall, looking defeated. "Dr. Richard, John, trust me. Whatever your story is, I want to help." John was silent for a long moment, as if fighting an internal battle. "Doctor, if I tell you my story, do you promise it stays between us?" "I promise." "And do you promise you won't try to convince me to do anything I don't want to?" "I promise that too." John took a deep breath. "Okay, but not here, not in the hospital." "Where then?" "At the square where we met the first time. Tonight, at 8 o'clock. I'll be there." The rest of the day passed slowly for Richard. He couldn't concentrate fully on his patients, thinking about what John might reveal. All the clues pointed to the same conclusion. John had been a doctor, and something very serious had driven him away from the profession. At 8 o'clock sharp, Richard arrived at the square. John was already there, sitting on the same bench, but this time without any books. "Dr. Richard, thank you for coming." "John, I'm here as a friend, not as a doctor, okay? Thank you. That makes things easier." John looked at the night sky for a moment before he began to speak. "My name isn't John Miller. It's John Robert Miller. I was a neurosurgeon." Richard felt a shiver. Neurosurgeon. That explained the deep knowledge and familiarity with complex procedures. "Was?" "I was for 18 years. I was considered one of the best neurosurgeons in Chicago. I worked at Mercy General Hospital." Richard's eyes widened. John had worked at the same hospital where they had met. "John, Dr. John, you worked at my hospital." "I did. 10 years ago." "What happened?" John closed his eyes for a moment. "I had a daughter, Doctor. Emily. She was 12 at the time." Richard noticed that John used the verb in the past tense. His heart tightened. "She developed a very rare and aggressive brain tumor. The best neurosurgeons in the country said it was inoperable. But I couldn't accept that. John paused, clearly struggling with his emotions. I was arrogant, Dr. Richard. I thought I could save anyone, especially my own daughter. You operated on her? I did. It was an experimental surgery, using techniques I had developed. Everything was going well. The tumor removal was perfect. But then... John stopped talking. Richard could see tears forming in his eyes. John, you don't have to continue if you don't want to. I need to, Doctor. I've kept this inside for 10 years. John took a deep breath before continuing. During the closure, there was a complication. A blood vessel I hadn't seen ruptured. In a matter of seconds, my daughter had a massive brain hemorrhage. Richard felt a lump in his throat. I managed to control the bleeding, but the damage was already done. Emily survived, but she was left in a persistent vegetative state. John, I'm so sorry. The irony, Doctor, is that if I hadn't operated, she would have lived a few more normal months. The tumor would have taken time to grow. But I robbed her of the last conscious moments she could have had. Richard didn't know what to say. As a doctor, he understood that surgical complications were part of the profession. But as a father, he couldn't imagine John's pain. And your wife? Helen never forgave me. And she was right. Emily was in a vegetative state for 2 years before she passed. Helen blamed me for every day of suffering. John, complications happen. You know that. Doctor, I operated on my own daughter against the advice of all the other doctors. I used her as a guinea pig for my arrogance. How can I forgive myself for that? Because you did it out of love. Any father would have done the same thing. No, Doctor. A good father would have accepted the diagnosis and given her the best possible last few months. I took that away from her. John stood up from the bench and started pacing back and forth. After Emily passed, I couldn't step into an operating room anymore. Every time I picked up a scalpel, I saw her face. Every time a patient trusted me with their life, I remembered that I had failed the person I loved most in the world. You stopped operating? I tried to continue for a few months, but my hands trembled. My concentration was gone. I became a danger to patients. And then, I resigned from the hospital. Helen had already left home a long time before. I sold everything I had and simply disappeared. Richard was processing all this information. Suddenly, many things made sense. John, how long have you been living on the streets? 8 years. And why do you still study medicine? John smiled sadly. It's the only thing I have left of her, Doctor. Medicine was our shared passion. Emily wanted to be a doctor too. Studying is a way to keep our connection alive. John, have you ever thought about returning to practicing medicine? Never. I can't put other lives at risk. But today, with your Robert, you saved a life. That was different. It was an emergency. Anyone with medical knowledge would have done the same. John, can I be honest with you? Of course. Your medical knowledge is impressive. Even after 10 years away, you're more up to date than many active doctors, and your ability to identify problems quickly hasn't diminished. Dr. Richard, I appreciate your words, but I won't change my position. I understand. But John, can I ask you a question? Of course. Do you think Emily would want to see you living like this? John stopped pacing and looked directly at Richard. Doctor, that's a cruel question. I'm sorry, I didn't mean to be cruel. But as a father, I imagine any child would want to see their father using his talents to help other people. My talents killed my daughter. No, John. A rare surgical complication killed your daughter. Your talents saved hundreds of other lives over your 18-year career. John sat back down on the bench. Dr. Richard, I know your intentions are good, but there are things you can't come back from. I crossed a line I shouldn't have crossed, and now I have to live with the consequences. John, can I suggest something? You can. Keep working at the library, keep studying, but maybe you could help in other ways. Teaching residents, for example, or help with complex diagnoses. No surgeries, no pressure. I don't know, Doctor. Think about it. You don't have to decide right now." They fell silent for a few minutes, each lost in their own thoughts. "Dr. Richard, can I ask you a favor?" "Of course." "Please keep this between us. I don't want people at the hospital to know who I used to be. Of course, your identity is safe with me. Thank you, and thank you for listening without judging me. Thank you for trusting me, John." They said their goodbyes, and Richard went home with his head full of thoughts. John's story was one of the saddest he had ever heard, but also one of the most inspiring. A man who had lost everything for the love of his daughter, who now lived in the shadows, but still dedicated his life to medical knowledge. Dear listener, if you're enjoying the story, please take a moment to like the video, and especially to subscribe to the channel. It really helps us, who are just starting out, now continuing. In the following days, Richard watched John with new eyes. Now he understood why he avoided direct contact with patients, why he only worked in the library, and why he had that constant sadness in his eyes. But he also noticed something else. John seemed more relaxed after sharing his story. A week later, something unexpected happened. Dr. William Thompson, head of the neurology department, approached Richard. "Richard, do you know the library employee, John Miller?" Richard tensed up. "Yes, I do. Why?" "I had an interesting experience with him today. I was looking for material on a complex case, a patient with atypical neurological symptoms. John not only found all the relevant material in minutes, but also made some observations that caught my attention." "What kind of observations?" "He suggested I investigate a paraneoplastic syndrome, said the symptoms matched anti-NMDA antibodies. I ordered the tests and he was right." Richard felt his heart race. "And did you find that strange?" "Very. John speaks like someone with years of experience in neurology. Do you know anything about his past?" "I know he really enjoys studying medicine," said Richard, trying to be vague. "Richard, that wasn't the knowledge of someone who just studies. That was practical clinical knowledge. Was he a doctor before?" Richard found himself in a difficult situation. He had promised John to keep his secret, but he also didn't want to lie to a colleague. "William, why don't you ask him directly?" "I already tried." He quickly changed the subject. "Then maybe you should respect his privacy." William became thoughtful. "You're right. It's just that if he really has medical knowledge, he could help us a lot, especially with complex cases like this one." That afternoon, Richard looked for John in the library. "John, Dr. William Thompson mentioned your conversation today." John looked worried. "Did I do something wrong?" "No, on the contrary. You helped him a great deal. But he's curious about your knowledge." "What did he say?" "That you speak like someone with practical clinical experience." John sighed. "I should have kept quiet." "John, don't blame yourself. You indirectly helped a patient. That's no reason for guilt." "Dr. Richard, do you think he'll investigate my past?" "I don't know. But John, even if he finds out, would that necessarily be a bad thing?" "Yes, it would. I don't want people to know who I used to be. I don't want the questions, the pressure, the expectations. I understand. But John, can I make an observation?" "Of course." "You're helping patients even without meaning to. Your knowledge is indirectly saving lives. That's different. Is it? John, today a patient was correctly diagnosed because of your suggestion. Tomorrow it could be another. You are making a difference." John was quiet for a moment. "Dr. Richard, I'm afraid." "Afraid of what?" "Fear of getting too involved. Fear of feeling the pressure of being responsible for someone's life again. Fear of failing again." "John, you have the right to feel that fear, but you also have the right to overcome it. And what if I can't overcome it? Then you keep doing exactly what you're doing now, helping in your own way, in your own time." 3 days later, an emergency situation would test the limits John had set for himself. Richard was in a complex surgery when he heard over the hospital's loudspeaker, "Code blue in the emergency room, code blue in the emergency room." Since he was in surgery, he couldn't leave. But he later found out that John had heard the call from the library and, moved by instinct, ran to the emergency room. When he got there, he found a desperate scene. A young woman about 20 years old had been admitted with stroke symptoms, but the on-duty doctors were confused because the test results didn't match the clinical picture. "She's too young for a typical stroke," said Dr. Wilson, the second-year resident. "But the symptoms are classic." John was watching from a distance, trying to restrain himself. But when he saw that the diagnosis was being delayed, he couldn't stay quiet. "Excuse me," he said, approaching discreetly. "Have you checked if she uses birth control?" Dr. Wilson looked at him strangely. "Sorry, who are you?" "I work in the hospital library. But birth control can cause cerebral venous thrombosis in young women. The symptoms are similar to a stroke, but the treatment is different." "You're right," said Dr. Parker, the senior doctor who was supervising. "Let's investigate that." Within minutes, they confirmed the diagnosis of cerebral venous thrombosis. With the correct treatment started quickly, the young woman made a full recovery. After the situation stabilized, Dr. Parker looked for John. "You saved that girl's life. If we had continued treating it as an arterial stroke, she could have had serious complications." "I'm glad she's okay," said John, already trying to walk away. "Wait, what's your full name?" "John Miller." "John, do you have medical training?" John hesitated. "I have been studying medicine for a long time." "That wasn't knowledge from someone who just studies. You have practical experience, don't you?" "Dr. Parker, I'd rather not talk about that." "John, I've worked here for 15 years. I've seen many doctors, residents, students. What you demonstrated today was the knowledge of someone with years of clinical experience. And not just knowledge, but also sharp medical intuition." John was uncomfortable with the attention. "Doctor, I really need to get back to work." "John, if you were a doctor and for some reason stopped practicing, I want you to know that you can still help a lot, even without being active." John looked at her with an expression that mixed gratitude and pain. "Thank you, doctor. But my situation is complicated." That night, Richard looked for John as he was leaving the hospital. He had heard about the incident in the emergency room. "John, I heard what happened today. I shouldn't have gotten involved." "Why not? You saved a young woman's life. And now more people are asking questions about me." "John, would that be so bad?" "Dr. Richard, I can't go back to being a doctor. I can't take on that responsibility again." "But you already are, John. In your own way, without pressure, but you are." "It's different." "How?" "When I suggest something, the final decision isn't mine. I'm not responsible for the results." "John, can I be direct?" "Of course." "You're hiding behind guilt, and that isn't honoring Emily's memory." John stopped walking. "What do you mean? Emily wanted to be a doctor, right?" "She did. Do you think she would want to see you wasting your medical talent because of guilt?" "Dr. Richard." "John, you made a mistake 10 years ago. A terrible mistake, one that had devastating consequences. But since then, how many lives could you have saved? How many patients could you have helped?" John fell silent. "I'm not telling you to go back to surgery tomorrow, but maybe it's time to stop punishing yourself and start honoring your daughter's memory by helping other people." "I don't know if I can." "Nobody's asking you to know. I'm asking you to try." John looked up at the starry sky. "What do you suggest?" "Keep doing what you're doing, but stop hiding. If someone asks about your past, be honest. If you can help with difficult cases, help. We'll take it slow." "And if I fail again?" "Then you fail. But what if you save lives? What if you make a difference?" John was thoughtful for a long moment. "Dr. Richard, can I ask you something?" "Of course." "If I decide to try, will you help me? Support me if things get tough?" "Of course, John. You're not alone in this." In the weeks that followed, a gradual change began to happen. John continued working in the library, but he stopped avoiding conversations about medicine. When doctors asked for help with complex cases, he responded with more openness. Dr. William Thompson became a frequent visitor to the library. He had noticed that John had exceptional neurological knowledge and began consulting him informally on difficult cases. "John," said William one day, "you have a natural talent for differential diagnosis. Have you ever thought about doing a medical residency?" John smiled sadly. "Dr. William, I'm a bit too old for a residency." "What do you mean? How old are you?" 52. John, I'm 48 and I'm still learning. Age is never a limitation in medicine. It's more complicated than that, Doctor. Do you want to talk about it? John looked around the empty library. Dr. William, can I trust you? Of course. I used to be a doctor. A neurosurgeon, actually. William stopped organizing the books he was handling. Really? I worked right here at Mercy General 10 years ago. John Robert Miller, exclaimed William. I remember you. You were a legend here at the hospital. One of the best neurosurgeons I've ever seen operate. John was surprised. You knew me? Of course. I was a neurology resident when you were at the peak of your career. I watched several of your surgeries. You were brilliant. William, a lot has changed since then. What happened? Why did you stop operating? John told his story to William, who listened in respectful silence. John, I'm so sorry for the loss of Emily. But you know that surgical complications are part of our profession, right? When it's your own daughter, it's different. I understand, but John, what you did for patients over 18 years was extraordinary. You saved hundreds of lives. And I took one. No, John. You tried to save the life most important to you, and there was an unpredictable complication. That doesn't erase all the good you did. William, I can't operate anymore. My hands, they're not reliable anymore. Who says you need to operate? John, there's so much more to medicine than surgery. Diagnosis, teaching, research, consulting. I don't know if I'm ready. What if we started slow? You could formally help with complex neurological cases. No pressure, no commitments. Just sharing your knowledge. John was thoughtful. Let me think about it. That night, John had a vivid dream about Emily. She was 12 years old again, like before the tumor. They were in the hospital library, and she was reading a medical book. Dad, why did you stop helping people? She asked in the dream. Because I failed you, my daughter. But Dad, you tried to save me because you loved me, and I know you helped many other children before me. But you... Dad, I don't want you to stop being a doctor because of me. I want you to help other children, other families. That's the best way to honor my memory. John woke up with tears in his eyes. For the first time in 10 years, he felt that Emily was speaking to him, not through guilt, but through love. The next day he went to see Dr. William in the neurology department. William, I accept your proposal. Seriously. I want to help with complex neurological cases, but gradually, without pressure. John, that's fantastic. I'll talk to the hospital administration to formalize your position. William, there's one condition. What is it? I don't want this to be publicized widely for now. I prefer to work discreetly. Of course, we'll do it your way. Dear listener, if you're enjoying the story, please take a moment to like and especially subscribe to the channel. It really helps us who are just starting out. Now continuing. Dr. William Thompson took the proposal to Dr. Daniel Foster, the hospital's clinical director. Daniel was known for being practical and direct in his decisions. William, are you telling me that the library employee is Dr. John Robert Miller? Exactly, and he has agreed to help with complex neurological cases. John Robert, and I remember him. He disappeared about 10 years ago, didn't he? He did. But now he's willing to come back gradually. What's his legal status, medical board registration? I don't know, I need to check. William, if we're going to formalize this, everything needs to be in order. Talk to him about the documentation. Of course, Dr. Daniel. When William talked to John about the legal aspects, he discovered a complication. John, did you maintain your medical board registration? No, William. I cancelled everything when I stopped practicing. That complicates things. For you to work officially, even as a consultant, you need to reactivate your registration. John felt uncomfortable. That will generate a lot of attention, a lot of questions. John, you can't hide forever. If you want to help patients again, you need to regularize your situation. Let me think about it. That week, while John was considering his options, a case arrived at the hospital that would change everything. A 14-year-old girl, Lily Rodriguez, was admitted to the emergency room with strange neurological symptoms that left all the doctors confused. She's having seizures, but the tests don't show anything to justify it, explained Dr. Wilson to the team. Normal EEG, normal CT scan, normal MRI. And the family history? Asked Dr. Parker. Single mother, difficult financial situation. The girl had been complaining of headaches for a few weeks, but the mother thought it was school stress. John, who was in the nearby library, overheard parts of the discussion as the doctors passed by in the hallway. The information caught his attention. 14-year-old girl, seizures, normal tests. Unable to contain himself, he approached the doctor's station. "Excuse me, doctors, did you mention a 14-year-old girl with seizures?" "John," said Dr. Wilson. "Yes, we have a complicated case. Can I ask a few questions?" "Sure." "Are the seizures focal or generalized?" "Focal, always starting on the right side." "And does she have a history of recent head trauma?" "Not that the mother mentioned. Have you investigated autoimmune encephalitis?" "Not yet. The symptoms are very recent." "And anti-NMDA antibodies?" Dr. Wilson and Dr. Parker looked at each other. "John, that's very specific," said Dr. Parker. "Why did you think of that possibility?" "Young girl, recent onset seizures, normal imaging scans. Autoimmune encephalitis caused by anti-NMDA antibodies is a possibility. It's rare but treatable if diagnosed early." "Let's order the tests," decided Dr. Parker. The results took 3 days to come back. When they arrived, they confirmed exactly what John had suggested. Autoimmune encephalitis, caused by anti-NMDA antibodies. "John, you saved this girl," said Dr. Wilson. "If we hadn't thought of that diagnosis, she could have developed severe psychiatric symptoms and taken months to be diagnosed correctly." John felt a mix of satisfaction and anxiety. It was rewarding to help, but also frightening to be involved in critical medical cases again. "Dr. Wilson, I'm glad she was diagnosed correctly." "John, can I ask you something?" "Of course." "How did you know to think of such a specific diagnosis?" John hesitated. He knew that sooner or later he would have to be honest about his past. "Dr. Wilson, I've worked with many neurological cases before." "You were a doctor." "I was. A neurosurgeon." Dr. Wilson was stunned. "Really? Why did you stop?" "It's a long story, doctor, very personal." "I understand. But John, if you have this knowledge, why don't you go back to practicing medicine? It's not that simple." That afternoon, Lily's mother, Mrs. Sarah, looked for John in the library. She had heard from a nurse that he had helped diagnose her daughter. "Mr. John?" she asked timidly. "Yes, that's me." "My name is Sarah Rodriguez. I'm Lily's mother." "How is she?" "Much better, thank God. And thanks to you too." John felt uncomfortable with the gratitude. "Mrs. Sarah, the doctors who treated her are the ones who deserve the thanks. But I heard it was you who figured out what she had. I just made a suggestion." Sarah sat in the chair next to John. "Mr. John, can I tell you something?" "Of course." "I'm a single mother. I work as a cleaner to support Lily. When she started getting sick, I thought I was going to lose my daughter. The doctors didn't know what it was. I was desperate." John felt a tightness in his chest. The situation reminded him of his own experience as a desperate father. "Mrs. Sarah, I understand your desperation perfectly. When I found out you helped discover what she had, I couldn't stop crying with relief. I'm very happy that she's better." "Mr. John, are you a doctor?" John hesitated again. "I was, Mrs. Sarah, a long time ago. Why did you stop?" "Some things happened in my life that made me rethink my career. But you saved my daughter. How could you have stopped being a doctor?" John didn't know how to answer. Sarah's sincere gratitude was stirring up emotions he had buried for years. "Mrs. Sarah, can I ask you something?" "Of course." "Does Lily have a father?" Sarah looked down. "He did. He left us when she was 8 years old. Said he didn't want the responsibility of being a father." John felt anger toward the man who had abandoned his daughter. "I'm sorry." "No need. Lily and I manage fine on our own. But moments like this, when she was sick, it's hard to face alone." "I imagine. Being a parent is the hardest thing in the world." "Do you have children?" John felt the question like a stab. "I did. I lost my daughter a few years ago." "Oh my God, I'm so sorry. Thank you. She was almost Lily's age. Was it an illness? It was complicated. Sarah realized John didn't want to go into details. Mr. John, can I say something that might be bold of me? Go ahead. If you were a doctor and are now helping other children like Lily, perhaps your daughter is proud of you. John felt tears forming in his eyes. Mrs. Sarah, thank you very much for those words. Mr. John, if you ever go back to being a doctor, promise me you'll take good care of the children, that you'll give them the chance my Lily had? Mrs. Sarah, I don't know if I'll go back to being a doctor. But if you do. John looked into Sarah's sincere eyes and saw the hope of a mother who almost lost her daughter. If I do, I promise I will do my best for every child. Thank you. That gives me peace. After Sarah left, John was alone in the library thinking about her words. For the first time in 10 years, he began to seriously consider the possibility of returning to medicine. That night, he looked for Richard in the hospital parking lot. Richard, can I talk to you? Of course, John, how are you? Confused, very confused. What happened? John told him about Lily's case and the conversation with Sarah. And how did you feel helping with the diagnosis? It was, rewarding, but also scary. Why? Because it reminded me of why I love being a doctor so much. Richard smiled. Is that a bad thing? I don't know. For 10 years, I convinced myself that I had made the right decision by stopping practicing medicine, but now you're having doubts. I am, and it makes me anxious. John, can I make a suggestion? Sure. How about talking to a therapist, someone specialized in helping doctors who have been through trauma? Therapy? John, you've carried this guilt alone for 10 years. Maybe it's time to get professional help to process all of this. I don't know if I'm ready for that. No one ever is. But sometimes it's exactly when we're not ready that we need help the most. Do you know someone? I do. Dr. Lauren Fields. She's a psychiatrist and works specifically with doctors who have been through traumatic situations. What if she thinks I'm a lost cause? John, you are not a lost cause. You're a man who went through a personal tragedy and is trying to find a way to keep living. That doesn't make you a lost cause. John became thoughtful. Richard, if I agree to therapy, will you come with me to the first appointment? Of course I will. Then let's try. The first appointment with Dr. Lauren Fields was scheduled for the following week. John was extremely nervous, but Richard's presence reassured him. Dr. Lauren was a woman of about 50, with a calm and welcoming manner that put John at ease quickly. Dr. John, or do you prefer I just call you John? John is fine. John, Dr. Richard told me a little about your situation, but I'd like to hear from you what brought you here. John told his story once more, but this time with more details about his feelings and thoughts during all these years. John, may I make a few observations? Sure. First, what you went through is a very specific type of trauma that affects doctors. Guilt over adverse outcomes. It's more common than you think. But it doesn't usually involve one's own daughter. No, that makes your situation especially complex, but not impossible to work through. Doctor, did I really do the wrong thing by operating on my daughter? John, that's a question only you can answer. But I can help you analyze your decision without the weight of the guilt you carry. How? Let's work to separate the father from the doctor. The father did everything he could to save his daughter. The doctor used his best skills in an extremely difficult situation. The complication that occurred was not the result of negligence or incompetence. But the outcome was the same. John, in medicine, sometimes we do everything right and still lose patients. That doesn't make us bad doctors. And when the patient is your own daughter, then it makes us desperate parents doing everything possible to save someone we love. John was silent for a moment. Doctor, how do I forgive myself? First, you need to understand that forgiveness doesn't mean forgetting or minimizing the pain. It means accepting that you are human, that you did the best you could with the information and resources you had at the time. And if I go back to practicing medicine, what do you think about that? I'm afraid of failing again. What if you save lives? What if you help other families like Lily's? I don't know if I can handle the pressure. John, you're already handling it. In the last few months, you've helped several patients indirectly. The difference is that now you can do it in a more direct and impactful way. Doctor, can I ask you something? Of course. Do you think it's possible for someone to become a doctor again after 10 years away? Technically, yes. Emotionally, it depends on the work we do here. And do you think it's worth trying? John, that decision is yours alone. But I can say one thing. Wasting a medical talent like yours would be a great loss for many people who could be helped. After the first appointment, John felt better, but also more confused. The doctor's words made him question many of the certainties he had built over the last 10 years. During the following weeks, appointments with Dr. Lauren Fields became regular. She helped John process his guilt in a healthier way and seriously consider the possibility of returning to medicine. At the same time, the situation at the hospital began to change. More and more doctors sought John out for consultations on complex cases, and his reputation as an exceptional diagnostician began to spread. Dr. Daniel Foster, the clinical director, eventually learned about John's true identity and scheduled a conversation with him. John, or Dr. John, I heard you've been helping our doctors a lot with difficult cases. Only when I can, Dr. Daniel. John, I'll be direct. The hospital needs doctors with your experience and knowledge. Would you like to consider coming back officially? Dr. Daniel, my situation is complicated. I know about your history. Dr. Richard told me some details with your permission. And what do you think? I think you paid too high a price for a surgical complication, and I think it's time to get back to doing what you do best. I don't know if I'm ready. John, no one is ever completely ready, but you can start slowly. Consultations, outpatient cases, no surgeries for now. And if I accept, what would my legal situation be? We will help you reactivate your license with the medical board. It won't be a quick process, but it's possible. John became thoughtful. Dr. Daniel, can I have some time to think? Of course, but John, I want you to know that you have our full support if you decide to come back. That night, John had another important conversation. Mrs. Margaret from the library approached him at the end of the workday. John, can I talk to you? Of course, Mrs. Margaret. I heard you might go back to being a doctor. I'm still thinking about it. John, in all these months working together, I've seen how you treat the medical books, how you know every subject, how your eyes light up when you talk about medicine. And what do you think about that? I think you were born to be a doctor, and I think it would be a terrible waste if you didn't go back. Mrs. Margaret, my story is complicated. John, I'm 62 years old. I've seen a lot in life. I know you went through something very painful, but I also know that carrying guilt forever doesn't honor anyone. What do you mean? If you had a daughter who wanted to be a doctor like you told me once, do you think she would like to see you wasting your talent? John was surprised. She was the second person to make this kind of reflection about Emily. Mrs. Margaret. John, I don't know what happened in your past, but I know you are a good person. You have extraordinary medical knowledge, and you can help many people. If I were your daughter, I would want you to go back to saving lives. Mrs. Margaret's words echoed in John's mind all night. For the first time in 10 years, he began to seriously consider not only returning to medicine, but also honoring Emily's memory by doing so. The next morning, he looked for Richard before the start of the workday. Richard, I need to talk to you. Of course, John, how are you? I've decided. Decided about what? I want to go back to being a doctor. Richard smiled broadly. John, that's fantastic. Are you sure? I am. Or at least I'm sure I need to try. What made you decide? Several things. The conversations with Dr. Lauren, the talk with Dr. Daniel, with Mrs. Margaret. But mainly, the realization that spending the rest of my life punishing myself won't bring Emily back. And it might stop you from helping other children like her. Exactly. If Emily wanted to be a doctor, perhaps the best way to honor her memory is by saving other lives. John, do you have any idea how you want to start? Dr. Daniel suggested consulting and outpatient care. No surgeries for now. Sounds like a good plan. Richard, can I ask you a favor? Of course. When I start seeing patients again, can you be around to give me support if I need it? John, it would be an honor to support you in this return. The process of reactivating John's medical license took 2 months. During this time, he continued working in the library, but he also began participating more actively in case discussions at the hospital. His first official appointment as a doctor was scheduled for a Tuesday morning. The patient was a 68-year-old man with complex neurological symptoms that other doctors couldn't diagnose. The night before the appointment, John barely slept. He was nervous, anxious, but also determined. Richard met him in the library on the morning of the appointment. "John, how are you feeling?" "Nervous. Very nervous." "It's normal. Any doctor would be nervous after 10 years away." "What if I can't do it anymore? What if I've forgotten how to examine a patient?" "John, medical knowledge isn't something you forget. It's like riding a bike." "I hope you're right." "I am. And remember, I'll be there if you need me." Mr. Anthony Smith arrived at the hospital accompanied by his wife, Mrs. Mary. They looked worried but hopeful. "Dr. John?" asked Mrs. Mary when he introduced himself. "Yes, that's me." "You must be Anthony?" "I am, Doctor. My wife insisted we come here. She did the right thing. Let's talk about what's been happening." John led the couple to the office. Richard stayed in the next room, available if needed. "Mr. Anthony, can you tell me about the symptoms you've been feeling?" "Doctor, it started with some dizziness a few months ago. Then I started having trouble walking. Sometimes I feel like my left leg doesn't obey me." John took careful notes. "Headaches?" "Sometimes, but not always." "Changes in vision?" "A little. Sometimes I see double." John continued with a detailed history, asking questions that demonstrated his deep knowledge of neurology. Mrs. Mary watched, impressed by how the doctor seemed to understand exactly what her husband was going through. "Mr. Anthony, now I'm going to examine you. Don't worry. Nothing will hurt." The neurological exam was thorough. John checked reflexes, muscle strength, coordination, and sensitivity. His hands were slightly shaky at first, but they quickly regained confidence. After a 40-minute appointment, John had a diagnostic suspicion. "Mr. Anthony, Mrs. Mary, I believe we have a good clue about what might be causing these symptoms." "What is it, Doctor?" asked Mrs. Mary anxiously. "Based on the symptoms and the exam, I suspect a condition called normal pressure hydrocephalus. It's when there's a build-up of fluid in the brain, causing the symptoms your Anthony described." "Is it serious, Doctor?" "It's a serious condition, but it's treatable. We'll need to run some tests to confirm the diagnosis." "What kind of tests?" "An MRI and possibly a lumbar puncture test to measure the fluid pressure." "And if it's confirmed, is there treatment?" "Yes, there is. In many cases, a procedure to drain the excess fluid completely resolves the symptoms." Mrs. Mary began to cry with relief. "Doctor, you can't imagine what we've been through these months. Other doctors said it could be Alzheimer's, that there wasn't much to be done." John felt a strong emotion. It was the first time in 10 years that he had seen the genuine gratitude of a family for his medical help. "Mrs. Mary, let's confirm the diagnosis first, but I am hopeful that Mr. Anthony can improve a lot." After the couple left, Richard entered the office. "John, how did it go?" "Better than I expected. It was as if I had never stopped." "And how did you feel?" "Good, really good. I remembered why I loved being a doctor so much." "Congratulations, John. You're back." In the following weeks, John's diagnosis was confirmed by the tests. Mr. Anthony underwent the drainage procedure and had a dramatic improvement. Within days, he was walking normally and without symptoms. The news of the return of Dr. John Robert spread quickly through the hospital. Many doctors who had worked with him years before were moved by his return. Dr. William Thompson organized a small welcome ceremony in the hospital auditorium. "Colleagues, it is with great joy that we officially announce the return of Dr. John Robert Miller to our medical staff," said William. For those who didn't know him, Dr. John was one of our best neurosurgeons and now returns as a neurology consultant. The auditorium applauded. John was moved seeing so many familiar faces. "Dr. John, Would you like to say a few words? Asked William. John stood up, nervous. Colleagues, thank you for the warm welcome. Being back at Mercy General is exciting and challenging at the same time. He paused, searching for the right words. I spent 10 years away from medicine for personal reasons. During those years, I questioned if I still had anything to contribute. But in the last few weeks working with patients again, I remembered why I chose this profession. Another pause. Medicine isn't just about technical knowledge. It's about compassion, about hope, about giving our best to alleviate human suffering. I promise that I will give my best to every patient who trusts in me. The auditorium applauded again. Richard, sitting in the front row, was visibly moved. After the ceremony, many colleagues approached to congratulate John. Among them, a surprise, Dr. Helen Miller, his ex-wife. John, she said, approaching timidly. Helen? John was shocked. What are you doing here? I heard through a friend that you had returned to work. I wanted to come and congratulate you. How are you? Well, and you? Better. Much better. They stood in silence for a moment, the weight of the years and the shared pain between them. John, can I say something? Of course. I'm sorry for the way I treated you after Emily, after she passed. I was in pain, I was furious, and I put all the blame on you. Helen, you don't have to. Yes, I do. You were suffering too. You also lost our daughter, and I blamed you as if you had done something on purpose. John felt tears in his eyes. Helen, I understand your anger. I really did go through with the surgery against everyone's advice. You did it out of love, out of a father's desperation. Any father would have done the same thing. Do you really believe that? I do. And John, Emily would be proud to see you saving other lives. They hugged for the first time in 10 years. It wasn't a romantic hug, but a hug of forgiveness from two parents who had finally managed to honor their daughter's memory. Helen, thank you for coming. This means a lot to me. John, I wish you success in your return. You are an extraordinary doctor. In the following months, John quickly established himself as one of the most respected neurology consultants in the hospital. His careful and empathetic approach with patients, combined with his exceptional knowledge, brought impressive results. He treated dozens of patients with complex neurological conditions, achieving diagnoses and treatments that changed lives. Each success was a small victory against the guilt he had carried for so long. One case in particular left a deep mark on him. A 13-year-old girl, Beth Sanders, arrived at the hospital with symptoms similar to those Emily had presented years before, severe headaches and behavioral changes. Dr. John, said the girl's mother, Dr. Patricia Sanders, who was a pediatrician at the hospital herself, I'm desperate. Beth is getting worse every day. John examined the girl carefully. The symptoms were indeed worrying, but this time he was determined not to repeat the mistakes of the past. Dr. Patricia, let's run all the necessary tests before making any decisions about treatment. The tests revealed a brain tumor similar to Emily's, but with one crucial difference. This one was in a location that allowed for surgical removal with less risk. Dr. John, said Dr. Patricia, would you operate on my daughter? The question hit John like a bolt of lightning. It was the first time someone had asked him to operate since the tragedy with Emily. Dr. Patricia, I haven't operated in 10 years. I don't know if... Dr. John, I know about your history with your daughter. A colleague told me. But I also know you are the best neurosurgeon we know. But what if something goes wrong? And what if it goes right? What if my daughter gets the chance that your daughter unfortunately didn't get? John was silent for a long moment. Dr. Patricia, can I have 24 hours to think about it? Of course, Dr. John. That night, John called Richard. Richard, I need your opinion on something very important. Of course, John. What is it? John told him about Beth's case. And what do you think you should do? Asked Richard. I don't know. Part of me wants to operate, wants to give this girl the chance I couldn't give Emily. But another part is afraid of repeating the same tragedy. John, can I ask you a few questions? Sure. Are you technically prepared to perform this surgery? I am. I've kept my knowledge up to date, and this surgery is technically less complex than Emily's. Do you have the support of a competent team? I do. Dr. Wilson has offered all the necessary resources. Then what are you really afraid of? Of failing again. John, what if you save this girl? What if this is exactly what you need to finally forgive yourself? John stayed awake all night thinking. By morning his decision was made. Dr. Patricia, I accept to operate on Beth. Are you sure, Dr. John? I am. I will give your daughter my very best. The surgery was scheduled for the following week. John spent the days preparing meticulously, reviewing every detail of the procedure. On the morning of the surgery, he was nervous, but determined. Richard and Dr. Wilson would be in the operating room to support him. John, how are you feeling? Asked Richard before they entered the room. Nervous, but ready. Remember? You're doing this for Emily too. I know, and that's exactly what gives me strength. The surgery lasted 4 hours. John operated with a precision and calm that impressed everyone in the room. His experience and knowledge were evident in every move. When he completely removed the tumor without complications, there was a collective sigh of relief in the room. Tumor successfully removed, John announced. Let's proceed with closure. The closure was done with extreme care. John checked every blood vessel, every structure, determined not to repeat the mistake that cost Emily her life. Surgery successfully completed, he finally said, after 4.5 hours of procedure. Beth woke up from the anesthesia without complications, responding appropriately to all neurological commands. Dr. John, said Dr. Patricia, with tears in her eyes, thank you so much. You saved my daughter. John felt a profound emotion. For the first time in 10 years, he had successfully operated on a child with a condition similar to Emily's. Dr. Patricia, it was a privilege to care for Beth. In the following days, Beth had an exemplary recovery. Within a week, she was back at school with no lasting effects. The success of the surgery definitively marked John's return to neurosurgery. He began operating on selected cases, always with extreme care and preparation. 6 months after his official return to the hospital, John received an unexpected call. Dr. John, this is Sarah Rodriguez, Lily's mother. Mrs. Sarah, how is Lily? Very well, doctor, completely cured, but I called for another reason. What is it? Lily wants to meet you in person. She knows you were the one who helped discover her illness. It would be a pleasure to meet her. Doctor, John, can I tell you something? Of course. After everything she's been through, Lily has decided she wants to be a doctor. She says she wants to help other children like you helped her. John felt his heart speed up. A girl he had helped save now wanted to be a doctor, inspired by her own experience. Mrs. Sarah, that is very moving. Dr. John, would you be willing to talk to her about medicine? Perhaps guide her on what to study? It would be an honor. At the meeting with Lily, John saw an intelligent and determined girl, very similar to Emily at the same age. Dr. John, thank you for saving my life, Lily said directly. Lily, I only helped with the diagnosis. It was other doctors who took care of you. But if it weren't for you, they wouldn't have known what I had. That's true, and how are you now? Very well, no problems at all. And your mother told me you want to be a doctor. Yes, I do. I want to help other children who get sick like I did. John remembered similar conversations he had with Emily. Lily, medicine is a very beautiful profession, but also very challenging. Are you sure? Yes, I am. And Dr. John, can I ask you something? Of course. If I manage to get into medical school, can you be my mentor? Can you teach me about neurology? John felt tears in his eyes. It was as if Emily were speaking through Lily. Lily, it would be an honor to accompany your medical training. 1 year later, John was completely reintegrated into medicine. He operated regularly, saw patients in his office, and had started teaching residents. His story became an inspiration for many doctors facing difficulties in their careers. He often gave lectures on the importance of seeking help in difficult times and on how to overcome professional trauma. At one of these lectures in the auditorium of Mercy General Hospital, John told his complete story to an audience of doctors and medical students. Colleagues, 2 years ago I was living on the streets of Chicago, having abandoned medicine out of guilt and shame. Today I am here operating again, saving lives and teaching other doctors. The audience listened in respectful silence. What changed was not my medical knowledge, which I always maintained. What changed was my ability to forgive myself and to understand that honoring the memory of those we have lost means continuing to help other people. John paused, looking at the audience. Medicine is a profession that confronts us daily with our limits and with our humanity. We all make mistakes, we all lose patients. What defines our career is not the mistakes we make, but how we learn from them and move forward. At the end of the lecture, many colleagues approached to congratulate him, among them a special surprise. Lily, now 16 years old, accompanied by her mother. "Dr. John, I came to watch your lecture," said Lily. "Lily, it's so good to see you here." "Dr. John, I took the medical school entrance exam. The results come out next week." "And how are you feeling?" "Nervous but hopeful." "Lily, no matter the result, I'm sure you will achieve your dreams." "Dr. John, can I tell you something?" "Of course." "You inspired me not only to want to be a doctor, but to never give up on my dreams, even when things get tough." John looked at the girl and saw in her a little of Emily, a little hope, and a little of the future of medicine. A week later, Lily called John with the news. She had been accepted into medical school at Northwestern University. "Dr. John, I did it. I got in first place." "Lily, I'm so proud. Congratulations." "Dr. John, are you going to keep your promise to mentor me?" "Of course I am. It will be a privilege to follow your training." 2 years after John's return to medicine, Mercy General Hospital organized a special ceremony to inaugurate the Emily Miller Pediatric Neurology Unit, a tribute to John's daughter. "John," said Dr. Daniel during the ceremony, "this unit represents not only the memory of Emily, but also your journey of overcoming and return to medicine." John was emotional. "Dr. Daniel, colleagues, this tribute means more to me than I can express. Emily dreamed of being a doctor and helping other children. Through this unit, her dream will be realized forever. The unit became a reference in pediatric neurology treatment, serving children from all over the country. John began to lead the unit, dedicating his life to saving children with complex neurological conditions. Lily, already in her 3rd year of medical school, interned at the unit whenever possible. "Dr. John," as she said one day, "when I graduate, can I work here with you?" "Lily, you will always be welcome here, but I want you to choose the specialty you like the most, not just neurology." "I've already chosen. I want pediatric neurology. I want to do exactly what you do." "Are you sure?" "Absolutely. You saved me when I was a child, and now I want to save other children." John smiled, thinking about how proud Emily would be to see a girl he had helped following in his footsteps in medicine. 5 years after his return, John had become a national reference in pediatric neurology. He had successfully operated on hundreds of children, trained dozens of doctors, and inspired many colleagues with his story of overcoming. On a quiet night, after a day of successful surgeries, John was in his office when he received a special call. "Dr. John, this is Beth Sanders." It took John a moment to recognize the name. "Beth, the girl I operated on 5 years ago?" "Exactly. Dr. John, I called to tell you some news." "What news?" "I just passed the medical school entrance exam." John felt a deep emotion. Another girl he had saved deciding to pursue medicine. "Beth, what wonderful news. Congratulations." "Dr. John, can I ask a question?" "Of course." "Will you accept another intern at the unit?" John laughed, emotional. "Beth, it will be a pleasure to have you here." After hanging up the phone, John was alone in his office, reflecting on his journey. In 10 years, he had gone from the depths of despair and guilt to becoming a respected and admired doctor again. More importantly, he had managed to turn his pain into purpose, honoring Emily's memory through every life he saved. He picked up a photo of Emily that he kept on his desk and said softly, "My daughter, I hope you are proud. I am saving other children in your memory. I am inspiring other girls to become doctors like you wanted to be. I am living the life you would want me to live." That night, John left the hospital at peace with himself for the first time in 10 years. He had found a way to turn his greatest tragedy into his greatest source of strength. The Emily Miller unit continued to grow and save lives. Lily graduated and specialized in pediatric neurology, working alongside John. Beth followed the same path. Years later, when John was over 60, he looked back and saw a life that, despite the pain, had been filled with purpose and meaning. He had learned that the hardest forgiveness is the forgiveness we give ourselves, but he had also learned that when we manage to do that, we can transform our pain into strength to help others. His story became a legend at Mercy General Hospital, that of the doctor who lost everything, lived on the streets studying medicine, and managed to get back on his feet to save hundreds of lives. But for John, the real victory wasn't in the awards he received or the professional recognition. It was in every child who returned home healthy, in every family that didn't have to go through the pain he had endured, and in every young doctor who was inspired by his story to pursue medicine. On a sunny morning, 10 years after his return to medicine, John was operating on another child when he felt a familiar presence. It wasn't something he could explain scientifically, but he was sure that Emily was there, proud to see her father saving other lives. The surgery was a success, like all the others, and when the child woke up smiling, John knew he had found the best way to honor his daughter, by making sure other families didn't lose their children like he had lost Emily. End of story. So, what did you think of this incredible story of overcoming adversity? Imagine going through such great pain and still finding the strength to start over and help other people. Let us know in the comments which part moved you the most, and if you've ever known someone who went through a similar situation. Don't forget to leave a like if the story touched your heart, and subscribe to the channel so you don't miss other inspiring stories like this one.